Welcome to Faith, Fiction, and Folklore, or as we like to call it, the Tri-F Podcast, where we try not to F the podcast up. And this is a continuation of the Senate hearing on the COVID-19 vaccinations. We hope you enjoy.
Was fueled by misinformation about the measles science, spread by a number of vaccine doubters or skeptics, including the now Secretary of Health and Human Services, Robert F. Kennedy Jr. That campaign caused the vaccination rate against measles in Samoa to drop from over 74% to just 34% between 2017 and 2018. Do you see parallels between the measles outbreak you helped to address in Samoa and the one that we're now seeing in Texas that has reached 31 states, including Hawaii, and the COVID-19 situation?
Thank you, Senator. There are more than parallels. It's just terrifyingly similar.
How?
So what happened? I'll give you the brief version. In Samoa was prior to the outbreak. 2 children had been given vaccinations, and tragically, there was human error, and 2 nurses who were later prosecuted made a mistake, a tragic mistake, and they used the wrong reagent.
TTNDJMC says they act like a drug made too quick, had no fatal risks, in which the school comment kids can learn at home from educated people and also gain a strong lymphatic immune system by going outside. Yeah. So it would be better, if I'm understanding you correctly, it would be better to have natural immunity than resort to this thing that was made very quickly. So yeah, I agree with you. If I understand your comment correctly, I agree with you.
The fluid with the vaccine, and they vaccinated incorrectly these 2 children, and the 2 children perished, which is, of course, tragic in every way, and we always have to hold all healthcare people to account. Now, after that, there was panic, and what happened in the months and years thereafter was that human error was not a vaccine flaw, it was a human error, and that information was then spread incorrectly by then Mr. Kennedy, before being Secretary Kennedy, and the Children's Health Defense. And that country and their leadership told me this directly. They received letters. There were stories all across Samoa that this group of people came and convinced them not to vaccinate. And they had a lot of challenges with health literacy, and they stopped vaccinating. And then when you get vaccination rates that are that low, and mind you, we have this challenge because we have 14 states. My state is among them, where the kindergartners in our states, age 5, sometimes age 6, are at dangerously low vaccination rates for measles. When it gets that low, you're going to see outbreaks. Unlucky. The cases could come from anywhere. They could come from overseas. They could come from within our own country. But if you get below 95%, and certainly below 90%, you see these outbreaks. And then you have, 1 in 5 people end up in the hospital. You have 1 in 20 with pneumonias. You have encephalopathies. You have all sorts of damage. So that's what happened in Samoa. And to be very direct, and actually I want to be generous here, there are many things that Secretary Kennedy is doing that I support. I support his work on some of the questions about processed foods and dyes and environmental toxins, things that I have believed for decades and fought for, as have many of you probably. However, this is so central to the public health of our country that because we have vaccine hesitancy, and because when you fall below 95%, and particularly below 90%, you will see these outbreaks. So we can anticipate that we're going to have a lot of outbreaks, first of measles, and there's going to be fatalities and lots of consequences. We're going to see pertussis. God help us all if we start seeing meningitis or polio break out. These are diseases that have been eradicated. And so what I would say is I really appreciate the chairman's focus on truth and making sure there's transparency and going through the record. I appreciate that. I appreciate individuals who I disagree with fighting for their voices. But what I don't appreciate is when there are individuals with no public health training, whether it's a senator or someone that's one of our colleagues, and they make a assertion to move away from science and away from prevention that has been proven, that I have deep concerns about. And that's what happened in Samoa, killing 83 people. We had to jump in, and then that is what is happening in Texas and a bunch of other states. And I don't think it would be very interesting to ask all the senators privately and congresspeople and all of us if any of us could accept that kind of spread of infectious disease amongst the people that we love. Even if we don't believe in vaccinations, we certainly don't believe in tragic outcomes, things that we can prevent. And that's where I think we should go as a country to heal.
Okay, so again, there is a distinction between the other vaccines out there and the mRNA. But to take his argument and think about it for a second, the reason that there is this distrust towards vaccines is because these guys lied about the mRNA. So because there's no accountability for the system, that's what's generating the distrust. It's not that people are asking questions about this particular vaccine. It's that there's a clear record of people being injured, and these guys won't talk about it because they want to protect their precious institution. So if they would actually create some accountability for when people screw up, that would restore the trust. As long as they're trying to defend these people in the name of protecting the institution's reputation, the distrust is just going to grow.
Interrupt. I apologize. I am the ranking member on the Veterans Affairs Committee. There's a separate hearing beginning right now. I have more questions. I'm going to try to come back, Mr. Chairman. And I apologize. I'm going to have to leave. Thank you.
Appreciate you coming. This is the part I was actually looking forward to. Unplugged. So, Governor, I'm just going to be honest with what gets under my skin is how many times those of us who've had a different narrative on this, or not a narrative, but just a different viewpoint on this, we are always accused of ignoring science. I think I've been trying to follow it quite closely. So again, I will ask you, and we can go through your testimony. Every time you cited something, we will ask you to cite the study that proves what you're saying. Okay? So again,
His study is the science, sir. He doesn't need to cite his source. His source is the science. Thank you very much.
not really a challenge, it's a request. I mean, I would ask that of all of you. Any of you who have cited some study or some opinion, back it up. And we'll include in the hearing record. We'll have this hearing record will stay open for 15 days, so I'm really encouraging people, send me that science. Again, I entered a piece from Raphael Lataster that pretty well debunks the Watson, I think it's Watson et al., that claims it's the COVID injection saved millions. This is based on mathematical models. It really wasn't scientific study. So again, throw it all in the hopper and let the public decide. But I do have some questions. Dr. Thorpe, speaking of corrupted studies, you mentioned in your opening statement the Shimabukuro study, which, by the way, Tom Shimabukuro, we have sent something like 70 oversight letters, more than that. In many of them, we've told the CDC, FDA, NIH, we demanded they preserve their records. And that should have been widely distributed throughout the agencies. You know, we, in our subpoena, specifically asked for the communications of Tom Shimabukuro. They couldn't find any. I know the current HHS is investigating that individual. We've sent I would call it a referral to the FBI and to Attorney General to determine this. But again, what happened there? Okay, again, when people are supposed to maintain records and they don't, I get suspicious. But again, going to Dr. Thorpe, And I'm going to probably interrupt you because I want everybody to understand what you're talking about in this study, because we're talking about numbers here, but describe that study on, would you call it fetal demise, miscarriage, and how it was originally presented as evidence to push this on the most vulnerable, as you're saying, pregnant women and the unborn. And how did they distort that study to make that point? Go ahead.
Thank you, Senator Johnson. So the study in question is in New England Journal of Medicine on April 21st, 2021. And in that same day, the digital edition, there were two publications that were extraordinarily concerning. Both of them, interestingly, coming at a time when vaccine hesitancy was increasing. So the Shimabukuro study was a separate study in addition to an op-ed. The op-ed was by the New England Journal of Medicine, editor-in-chief, who was Eric Rubin, and the managing editor, who was Stephen Morrissey, and then director of the CDC, Rochelle Walensky. And they made statements that were false. They made statements that was fear-mongering, insinuating that pregnant women, if they didn't take the vaccine, would put their lives in harm, their preborn lives in harm, and their newborn lives in harm, when they knew absolutely the opposite was true.
How did they know that?
Well, they know that for several reasons, Senator. Number one, the study by Pinnells and colleagues, who is a maternal fetal medicine specialist from University of Texas, Houston, published a very large study documenting that pregnancy in of itself reduced the maternal mortality by as much as 75% during pregnancy compared to non-pregnant women. That study was available. Also, Dr. Shimabukuro, Tom Shimabukuro, and then director of the CDC, this was 7 weeks after the Pfizer 5.3.6 post-marketing data in 10 weeks that showed the COVID-19 vaccine was the deadliest and most injurious vaccine ever released, with 42,086 injuries, including 1,223 dead. They had that information. They still pushed it on pregnant women.
So let's get to the number where there's 700 individuals included
Okay,
in
here
the
we go.
statistic that shouldn't have been included. So describe that. I mean,
Right.
talk about this study.
Right. Well, there's bias. There's bias in the title, okay? Just look at the title. There's bias in the 21 authors, all of whom were federal employees, and Tom Shimabukuro, a safety officer in the FDA itself. Then you go to the numbers. We're looking at about numbers of over 4,000 in a 10-week period. And then all of a sudden, it's just, how do we arbitrarily go to 10 weeks in this V-safe smartphone collection system? And then what happened to all the other patients? We go down to 827 patients. What happened to the rest?
So you got 827 patients that became pregnant or were pregnant in this, in terms of, again, it's not really a study, but I mean, they're just analyzing data. So you got 827.
Right.
Okay, so these were women who were pregnant.
Right. 827 that completed a pregnancy in 10 weeks.
Which is not necessarily a born child, but the pregnancy
Or
is.
a miscarriage, right.
Okay.
Now, they claimed a 12.6% miscarriage rate.
Which is pretty kind of a normal miscarriage?
No, it's not. No.
What's a normal miscarriage rate?
3% when you have a normal booking visit.
Okay,
and you have
it's already an abnormal miscarriage rate in that 827.
That's correct.
Okay.
And so
now describe exactly how they.
Okay, so we have 827 patients, right? And they talk about a 12.6% miscarriage. But a miscarriage of those 827, 700 of those mothers had their vaccine in the 3rd trimester.
Ah.
That's way beyond the window when a woman has a miscarriage. So they artificially took those 700 patients and put them in the 1st trimester. No, the 104 patients that had the miscarriage, that goes to the 127. 104 over 127, you're looking at an 82% miscarriage. So the key is the percentage of women that got the vaccine in the 1st trimester had an 82% miscarriage. And by the way, that's the exact same miscarriage rate that was seen in the Pfizer 5.3.6 post-marketing
So
data.
I would argue that proves both points in the title of this hearing: the corruption of science, the corruption of federal health agencies. You know, Governor, listen, I'm cognizant of the fact that you're kind of outnumbered here. So I want to give you an opportunity to respond to that if you want to. You don't have to.
Okay, so if I understood that correctly, and somebody please correct me if I'm wrong, it sounds like the 700 that Blumenthal was mentioning had actually taken the vaccine. Am I hearing that correctly? Because that's what I thought I heard. So if I'm incorrect, somebody please correct me. But it sounds like they counted a vaccine death as a COVID death. Somebody can comment if they so desire.
No, I'm happy to. Look, appreciate the information. The tragedy of a miscarriage is always there. It's not 3%.
What is it? What do you think it is?
Well, in my training as a family physician, the miscarriage rate for women is often in the 20s or 30 percentile. For women across their pregnancies, there are just a lot of miscarriages that occur amongst women. So those are all tragic, and I would obviously defer to ACOG, the American College of OBGYNs, who did, and they should come and testify too, who did strongly recommend the vaccine. I mean, I'm not going to speak as an OBGYN. I'm speaking as an ER physician and as a governor. But I'm sure that would be a vibrant discussion. And again, it's a very good point that we have transparency in studies.
So let me move on to my next point. In one of our events, some of you were there, there's Dr. Moon opened up the insert for the COVID injection. Big piece of paper, fold up, and it's, other than it says intentionally left blank, it's blank. Now this was quite a few years, I think this was probably a couple of years into the COVID injection, distribution of it, and all these studies, everything on VAERS, I would think somewhere, when you take a look at the actual studies and the adverse events that were documented within those studies, it's now been released through the Pfizer papers and other means, you would think somewhere they ought to put some information in there. So the point I want to make is I think an awful lot of folks are saying that there was not informed consent. I would argue they violated the inviolable principle of informed consent with this COVID injection. I just think that's indisputable. I'll start with you, Dr. McCulloch. Do you want to weigh in on that?
I've presented at the FDA advisory meetings. I've advised companies for decades on this, so I know the regulatory science very well. When a product definitely results in death, and there are thousands of peer-reviewed papers on this, Governor, the COVID vaccines in some people, sadly, result in death. Some on the very first day they take the shot. That must be a black box warning on the product immediately. I just checked the package inserts for the currently available products, the ones that Senator Blumenthal wants to pursue. Sounds like Governor wants to still pursue these. Our FDA still wants them to be administered. They still don't have the word death in the package insert. As of today, they don't. And so Americans are not fairly informed.
Do you have any doubt in your mind that the COVID injection caused some deaths? I mean, what do you think of the, 38,607 right now listed on VAERS? What do you think the real number is? And do you have any science to back up your opinion?
The best data are autopsies. So in the largest autopsy series published to date, I know because I'm the senior author, of all the deaths we examined, and we re-reviewed them, we had an adjudication committee, we had ways of arbitration, deciding on did the vaccine cause death. The answer is, of these cases that came in for autopsy after vaccination, 73.9% of individuals, it was determined that the vaccine was the cause of death. First author is Holscher and colleagues, who's sitting right behind me.
And again, by FDA's own laws, that should be included on that package insert, correct?
Immediately in 2021, Dr. Carol Tassetta, working with the Daily Cloud, wrote Peter's Marks in the summer of 2023 and said, where's the black box warning? Where is it? No word from Marks.
Dr. Vaughn, you want to weigh in on the informed consent?
Well, the other thing is, I think emergency use authorization, actually by definition, when you fill out the documents for the patient, if they read it, it actually says that they should make sure that they are under no compulsion to get this product. And that is what's so confusing, because even though the product was mandated in the summer, at the end of the summer of 2021, the product on the shelves was still the EUA product. And in that sense, for somebody to be mandated to something that they also have to sign to say that they weren't mandated to do it is kind of hard to do legally.
By the way, that's the subject of a couple oversight letters in terms of the whole full authorization type thing. Dr. Thorpe, quickly?
Yes, on informed consent, there was completely the opposite in pregnant women. HHS appears to have captured the American College of Obstetricians and Gynecologists, and my research team, including Maggie Thorpe, JD, have proven that with the Freedom of Information Act.
For a few,
So
for a few $1 million, correct?
many $1 million. They captured ACOG. In December of 2020, everybody at ACOG and the other organizations, we're not going to push this vaccine in pregnant women. In the span of a pregnancy, 40 weeks, September 27th, 2021, you will push the vaccine. You will push it in pregnant women and follow all the HHS criteria. And if you don't, we will destroy you and your professional career will take your license away and we will decertify you. That went out to 60,000 OBGYN doctors. So
we probably should have expanded the title of this, corruption of science, federal health agencies, what would you call those? Professional organizations?
these are the three organizations that essentially govern obstetrical care, not just in the United States of America, but the whole world.
By the way, I wanted to ask you, to what extent are the medical journals funded by various conflicting organizations, pharmaceutical companies? I've heard Chinese interests. I mean, are you aware of that? You were talking about the article written by the editors of the New England Journal of Medicine.
Yes, I'm aware of the study by Wen and colleagues, David Daniel Wen, that was just published October 10th of 2024, documenting that 1.06 billion with a B dollars went to the reviewers of the medical journals, of probably the most influential medical journals, New England Journal of Medicine, Lancet, BMJ.
And that's coming out of the pharmaceutical industry.
That's correct.
So Dr. Walscott, as a vaccine injured, do you believe you received informed consent?
Absolutely not. Absolutely not. I mean, informed consent, and I, as a physician, I believe strongly in informed consent. Informed consent requires true and transparent data. And we can sit here and hear the mantra or the typical narrative of safe, effective, saved millions of lives, but in reality, that's not true. Okay? We can talk about efficacy if we want. Again, certainly the vaccines don't prevent infection, don't prevent transmission. I think I could present to you, I mean, and refer to a lot about safety data, particularly with regards to all the adverse events that I think there's more than ample evidence that the federal regulatory agencies ignored. A lot of these systems, VAERS, vSafe, I call deliberately deficient by design. So do I think I got informed consent? No. Do I think anyone here in the United States in the last 4 years have gotten informed consent in considering getting a COVID vaccination? Emphatically, no.
So by the way, my theory, and it's just a theory, I don't have the, proof, it's hard to prove these things. But my guess is the reason they were so concerned about issuing a warning on the HAN is, again, they didn't want any vaccine hesitancy on this, right? And also, if they alerted doctors to the fact that if you have a patient with myocarditis, you might want to ask them, did you just get a vaccine recently? And otherwise, the doctor is looking at myocarditis trying to figure out how to treat it, right? Not trying to figure out the cause, because myocarditis does happen. Dr. McCullough, quickly.
Quickly, myocarditis was so common that in the UK and Australia, they actually did issue guidelines to doctors on how to recognize it and when to get MRIs. That's how big a problem vaccine myocarditis is.
Also, one of the points I made is they did not warn, they didn't advise doctors to advise against strenuous physical activity, right? They pulled that off of the one warning that they gave. I mean, talk about how dangerous that is. And also, the mild. Talk about how often myocarditis is mild versus serious.
Before the pandemic, there was myocarditis. Can be caused by Coxsackie virus. The most dangerous type is called giant cell myocarditis. It was very rare. I had seen 2 cases in my career. One was fatal. But it's in our guidelines. Anyone who develops myocarditis cannot undergo strenuous physical activity. They have to be taken out of sports. It's mandatory because the surge of adrenaline when there's inflammation in the heart triggers a cardiac arrest. So you can imagine how reckless it was for the sports teams to mandate vaccines on athletes, provide no provision of safety, and then have them go out on the field.
I believe now in Europe there are, or maybe even throughout the world, I believe there are defibrillators on the fields thanks to all this. It's like a relatively new thing because myocarditis has become so common. So there's that.
Health officials, when they're discussing putting that warning, that advisory for physicians as they did their kind of weak need warning on myocarditis, what does that tell you? Why would they pull that out?
It was reckless not to provide prudent guidance on reducing the risk of cardiac arrest when a patient has vaccine myocarditis. Whether it's acute myocarditis that we clinically recognize, by the way, 90% are young men, 90% are hospitalized. Tracy Hogan, others at UCSD show that, multiple studies, but there's a larger group of subclinical myocarditis. These are patients with heart palpitations, blood pressure swings, atypical chest pain. Listen, this is water under the bridge. Fortunately, very few people are taking COVID shots anymore, but these patients still have symptoms. A recent report by Koyosmu in Journal of the American College of Cardiology has shown cardiac arrest in people years after the vaccines, and they have found vaccine microscars in the heart.
And we can keep going down this. I did want to go to Mr. Siri, who does a really good job of describing vSafe, because you actually had to sue. You should have had to sue, by the way, right? First of all, the health agencies who set up this vSafe, voluntary online report on specifically the COVID-19 injection safety surveillance, right?
Yeah, vSafe.
10 million people signed up voluntarily. You would think the federal health agencies would make that information just available anyway, but at a minimum, when you FOIA'd it, Freedom of Information Act, you think they would have just handed it over to you, right? They didn't do that, did they? You had to sue them. How long did it take you to actually get that vSafe data? And then why don't you describe what you've got and why they were probably trying to hide it?
Sure, it took over 2 years, and you'd also think with a name like vSafe, it would have been designed to actually assess safety with regards to the COVID-19 vaccine. So vSafe is a program that the CDC rolled out in December of 2020, along with the first rollout of the first COVID-19 vaccines. And as you just pointed out, Senator, the point was to asked people to sign up. 10 million Americans signed up, almost all of them in the first 6 months. This was when there were no mandates. These were folks who were enthusiastic about getting the vaccine. These were the folks who who felt it was their civic duty. In fact, that's part of what they checked of why they signed up for VSafe. And so over the next 2 years, the CDC kept putting out study after study after study, dozens of them, in which it said the COVID vaccine is safe. When you look at those studies, what is it relying upon? One of the primary data sets it's relying upon is the VSafe data, okay? And so on behalf of our client ICANN, we, as you pointed out, submitted a Freedom of Information Act to the CDC, and we said, hey, this data you're collecting in VSafe is almost all de-identified, because most of it's checked the box. Please provide it. The American public pays for it. You're public servants. American public should have access to it, should be able to do what scientific inquiry is supposed to do, which is replication.
By the way,
Yes.
quickly, what did they ask and what didn't they ask on the VSafe?
Yeah,
I mean,
so,
talk how
so
grossly
it-
inadequate it was.
yeah. So, I mean, I understand this hearing's about, did our public health agencies do things that were improper? Did they have scienter? Did they purposefully do things improper? And when you look at how VSafe was designed, I think you'll see that. So VSafe had check-the-box most of what VSafe collected was via check-the-box options. Then it had some free text field. There were two categories of check-the-box options. The first category were symptoms. So you could check the box for various symptoms, right? And the
Like, maybe give us an example.
fever, local, little pain.
The standard minor things, right?
Right. And so those symptoms, the VSafe system only asked you for the first 7 days after injection. And as Dr. Shimabukuro even said in an email that we obtained via FOIA, those were the expected reactions. It's what they called almost immunogenicity. It shows the vaccine is working. And so the symptoms that they picked were totally useless for assessing the safety of the COVID-19 vaccines. And in fact, when you look at the studies that the CDC published, people were reporting those symptoms at 40, 50, 60% of them. Yeah, they reported, pain in the arm, of course. But they were viewed as normal to have a little chill, have a little fevers. And so that part of VSafe was totally useless for assessing safety. So that wasn't useful. What was left? The only other thing that was checked the box was if you sought medical care, if you missed school or work, or if you were unable to perform normal daily activities, and if you checked that you missed, you needed medical care, it then asked you, were you hospitalized, emergency room, urgent care, or telehealth, okay? So that was the data they were collecting. So presumably, VSafe was gonna assess safety by looking at people who sought medical care after vaccination, because everything else they collected on check the box was, at least on the symptoms, was not useful. Now, before I go on to tell you what the healthcare seeking data showed, I just want to go back to the symptoms that the CDC chose. One of the things that we obtained was a copy of the very first version of the design documents for creating VSafe. And when you go to the last page of that design document, it's in my 66-page submission. Everything I'm saying is in the 66-page position with citations and support. What you will see is they had a table. It was called Adverse Events of Special Interest, Pre-Specified Medical Conditions. And on that list, it had myocarditis, it had pericarditis, it had all of the issues that we now see and people have reported with regards to COVID-19 vaccine. It was in their design document before they launched VSafe, but not a single one of those conditions ended up as a check the box, or at least the symptoms of those conditions. You could have put in at least chest pain if you didn't want to use the word myocarditis or pericarditis, but they didn't do that. To me, that is the best evidence, one of the best pieces of evidence out there that our federal health authorities knowingly, consciously chose to design this system. It was not to determine safety. It was in order to assure their a priori assumption of safety. At the end of the day, CDC is a government agency. In my experience, they don't conduct themselves based on what folks would call science or medicine. They are a policy organization. They set their policy, and then everything that they do has to conform with that policy, and their policy is safe and effective.
Okay, so again, voluntary
So I
system
really like
and-
that segment because what it shows is even the statistics and the things that Blumenthal was resorting to, and the numbers that I'm sure the governor of Hawaii was resorting to, all of them are basically examples of these guys fudging data. That's the ultimate problem. These guys keep screaming, trust the science, trust the science, trust the science. Well, in the point of fact, we can't. because these guys are rigging the numbers, they're rigging the studies, they're changing definitions, they're altering the kind of symptoms that make it impossible to check certain things. They're doing all these little things to alter the data so that they can hide the damage that the vaccine is causing. And this is going to take major reform, and it's going to take getting rid of a good chunk of the people there. You've got to restructure things in order to, quote unquote, reestablish trust in the science or whatever.
1 million people signed up.
Yes.
They've tracked all this data, inadequate, check the box information.
Not only inadequate, yeah.
And what they should have been just making available online, like quite honestly, like VAERS. I mean, VAERS available. You can see it, okay?
They should have. And
They should have made that available as well. They didn't. And so you had to sue. When did you sue them?
sued them. It would have been a few months after the rollout of the COVID-19 vaccine. And
Okay,
it took us a year and a half.
early in 2021.
It took us 2 lawsuits, actually, because in order to make them take contradictory positions, so we sued them 2 different ways, and only when they had no choice, they finally released the data after
And
a year and
you
a half.
first filed a FOIA request.
Yes.
And they should have just boom, they should have handed it over to you.
If
right?
they wanted
Because
to be
they obviously
transparent.
were collecting this data, had to be kind of centralized. Wouldn't have been that big a task, I wouldn't think, here's what the data shows
It would
us.
have taken them seconds.
They should have, by law, should have just turned it over to you.
They should have.
And they didn't. So you had to go to court, and it took you 2 years.
It took it.
Okay,
to
and
get
then, so now drum roll.
Yes.
What did the VSafe data show once you finally extracted it by a lawsuit using the courts?
Yes.
What did they show you about how safe the
Here's
COVID
what
injection was?
Here's what it showed. In contrast to the dozens of studies that the CDC relied upon to say that COVID-19 vaccines were safe using VSafe data, where they only reported the first week of what people reported after the injection seek medical care, even though they know that injuries from COVID vaccine can happen well after the first week, but they only reported the first week to make the number look low. And even though they designed the system to collect medical seeking behavior for 6 weeks after getting the vaccine and 3 more instances after that, when we got the data, it showed that 7.7% of VSafe users reported needing medical care after the COVID-19 vaccine. And 75% of those reported they were hospitalized, emergency room, or urgent care, and on average, they sought medical care 2 to 3 times each. All of this data is publicly available now, and so if you ask,
And by the way, and a quarter missed a day of work, which, by the way, Thomas Bakura, in a video before the emergency use authorization about the safety surveillance system, said, we're going to take this so seriously. If somebody loses a day of work, we're going to have a CDC official on the phone following up, checking it out. Was that your experience, Dr. Walskog?
Absolutely not.
Not exactly. Did you want to say anything else about that? I know I've been kind of stomping on you.
no, not at all. No, it's just this. When they designed VSafe, the only data that probably could have assessed safety was medical seeking behavior. So you would hope our federal health agencies had a number. Look at how, how often COVID itself injured people. So you want to make sure the vaccine's safer than that, right? So was it 1 in 200 sought medical care? They pulled the plug? 1 in 100 people reported seeking medical care VSafe, then they'd pull the plug? The data showed 1 in 13 people sought medical care on average 2 to 3 times each. I don't think there was a number, unfortunately, that would have been sufficient for a CDC to pull the plug.
So what we sought for years is their analysis of VAERS, the proportional reporting ratio, which they did release some of those through FOIA to news organizations, that type of thing, not particularly useful. And by the way, they didn't particularly like that statistic anyway, so they did empirical Bayesian analysis. Never got it. Over a year, never got it.
Well, we have
Why?
2 federal lawsuits still going on right now for
Why?
the EB data.
Okay, now we're starting to get some of it. Okay, and again, I don't want to steal thunder or jump the shark on things that I know about that are being studied, but I think it'll be shocking to people to realize that they definitely had signals in empirical Bayesian that they were not reporting. And it will show. It's kind of complex, but this will be shown.
Well,
Okay, so that's what I say. They say, well, you're not proving the case on this myocarditis. No, this is the tip of the iceberg, of the cover-up, of the downplaying, and you have to ask why. Governor, just this story, were you aware of the story of VSafe?
Through the testimony, I should probably be allowed to comment. There's been a
No,
lot of
that's what I'm saying.
comments, and we
I'm-
talk
I'm-
about commenting and so on, because it's true, I'm pretty outnumbered here. Look, the couple things. First of all, VAERS, all right, which has been mentioned a bunch of times. It's not an adjudicated reporting system. It's valuable to get input, which we're grateful for, but it is a flood of experience, and there is no, there's no clear causal connection. No, I see your numbers, but that
So
doesn't.
did that cause you concern?
No, it didn't. I'll tell you why. Because we do want input, massive input. I'm grateful that there were people putting that in there, but that's why we do science and studies. We don't just do what this
Of course,
is.
what he means by science and studies is my people. What did he say a second ago? Oh, it was a flood of experience. But that experience doesn't count because it's not my guys. It's not my people. You got all this testimony. We're not going to bother showing, like the other guys did, how this testimony was altered and manipulated. No, we're not going to go into any of that sort of detail. We're just going to say, well, it's not, I don't like those opinions. And just think about the delusion you have to be under to sit there and look at that number that he just presented on that chart. Virtually nothing, then all of a sudden 21,000. He's like, that didn't scare you? No, not at all. I'm not worried. I don't know if I remembered why he said he wasn't worried, but just think about that. Oh yeah, I did. He said it was all correlation. It was all correlation. There's no causation there. It's just there's 21,000 people just randomly died. Just random. No, can't prove it's the vaccine, so why should I care? Not particularly interested in who caused that 21,000, what caused those 21,000 people to die. Not going to offer a counter theory. No, just doesn't prove it. Nope, it's fine.
So that,
I'm going to argue with you here, okay?
Fine.
So here's the problem, because I was going to go down this road. They didn't see safety signals because they didn't want to see them. They had them. They wouldn't report on them. They lied to us. So that's what I'm trying to get at. They lied to us, just like they lied and said, this thing's going to stay in your arm, when they knew it wouldn't, and we know conclusively it does not. They talked about the mRNA. This can just, it's going to go in there, stay in the arm, it's going to dissolve, in hours, couple days, whatever. But they knew it wasn't mRNA, it was modified RNA, and it stayed in the body, together with the spike protein. And we have studies of that. They're not talking about that as they continue to push this. So again, they've lied to us. So again, you can keep saying that, follow the science. No, the science has been corrupted and the agencies have been corrupted. So we have not been able to believe in them.
Exactly.
That's why they have no credibility.
I'm entitled
Go
to
ahead,
answer
Governor.
many of these things. So we certainly disagree on a lot of things, okay?
Yes.
One of them is that you say corrupted and corruption, and that is possible, okay? But I didn't have that. I'm just sharing with you as a doctor and a governor and a public health officer and who had a great response for our state. We didn't have that experience. We did have a great...
By the way, I have checked other island nations and stuff.
Go ahead, check them.
Be interesting.
We were advising them. They were calling me for advice, and that's why we did safe travels, like the senator bristled at. We did actually find ways to help people know whether or not they had COVID, whether or not they'd spread it, whether or not people were at risk. We did that work, okay? Other people may have been, not doing that work. I don't know if anybody in this room did that work. I did the work, okay? I was out there saving lives either in the ER or as a lieutenant governor. Everyone else is talking about corruption, okay? I was doing the work.
We had doctors that had the courage to treat COVID patients as well. So.
Yeah, and I was a COVID patient also and in isolation for 14 days, and it was the right thing to do at the time, September 11th of the first year, because we didn't know if I would spread it to my children or to my wife or to other people that I cared deeply about or my constituents. So I honored it, unlike others might
That's
not.
such an interesting argument. It's illogical, but it's interesting. There might have been corruption, but it wasn't me. I didn't do it. Well, nobody's blaming you, dude. We're saying that these guys that were in charge of the whole thing were lying. Well, it's okay. I didn't know. I'm not responsible. That's really what he's saying. I'm not responsible for this. I didn't do nothing. He's out there defending himself. But it ain't about him. It's about the institutions. These people that we're supposed to trust. But no, we're not going to think about that. We're just going to cover our own butts. I didn't do it. I'm not responsible. I operated with the information I had at the time. Well, nobody said you didn't. But you got bad information because the people at the top were lying.
okay, being in quarantine. So that's a different topic. Now, we've talked about myocarditis a lot, okay? And we are going to differ in our opinions about the data, I'm sure. However, there were about 12 cases from one perspective per million second shots. That's one of the studies and reports. I'm sure other gentlemen at this table are going to dispute that and have disputed that completely. But I will tell you that we saw one heck of a lot more terrible cardiac issues, myocarditis, far more clots for people that ended up in the ICU that we had to treat. We saw cataclysmic numbers when people got bad COVID and ended up at the hospital, but they didn't get bad COVID when they got vaccinated. That is the point. Now, we're walking
Define
past,
bad.
We're walking past a lot of those issues.
Okay, can you cite the study?
He's done this a lot. He's like, well, it wasn't as bad. Compared to what? Like, how are you measuring it? And he's never answered that question. He said, well, it wasn't as bad. There was improvement. Are you sure that improvement wasn't some kind of ink block test? You saw improvement because you wanted to? Like, how were you measuring the improvement?
Who's that?
Yes, and I'm
Yeah,
happy.
So provide them. I
Of
mean,
course
if you can't,
we will. Of course we
pro-
will. And you
pro-
can
pro-
there's another,
provide-
there's another 24,000 pages of data on both sides of this argument, okay? And everybody knows that the colossal damage to human
Again,
beings.
will you provide this committee that
Of course
study?
we will. And all of the data, nationally and internationally, showed that people had these complications in much larger numbers from severe COVID than they did from vaccinations, much larger numbers. Now, we can have that debate, and we'll get you at plenty of studies, okay? And the studies will be, he's shaking his head, but that's what the vast body of mainstream researchers and mainstream healthcare providers feel. Now, I don't want to disparage my colleagues that are up at this table, okay? But I will tell you that we are going down a rabbit hole to demonize the vaccinations. And maybe someday we will find that there should have been more transparency. Maybe people will find ultimately, that vaccines cause more harm than people were able to report at the time. However, it's my firm belief as a provider of healthcare and a person who had to make a state plan that there is value in providing vaccinations like this. And next time we have a pandemic, it's going to be even more serious if it ever affects children. I will tell you, people are going to clamor for vaccinations if children are terribly affected. And the country, you think it was shut down before, it's going to be shut down 50 times worse. We work to open the state.
No, they
That was a
aren't. That's the whole problem from your perspective. They're not going to clamor for those vaccinations because of this incident. That's why they want to clean this thing up, because a lot of these guys want to restore trust in the institution. I'm dubious about whether that's even possible, but these guys want to restore the trust. They're saying these people are lying. And the reason that matters is because they won't clamor for vaccines in the future if there is some other pandemic or what have you. The distrust is what's going to cause the vaccine scare you're so afraid of, but it's the lying that's causing the distrust. So you have to fix the line. You can't just sit there and go, well, yeah, we might find out someday, but we should really trust them. You know, we should trust them. Because there's too many people who've had personal experiences that ended poorly. So, and it's amazing. He's practically, the guy has no rebuttal to any of these points. And he's gotten to the point where he's like, well, maybe we will find out that someday. No, there is no maybe. We already have. That's the problem. There is no maybe we'll find out there was corruption someday. Pfizer hid the data. These people hid their data. That's been proven. There's no maybe about it. And to sit there and say we should ignore it for fear of a vaccine scare is just going to cause a vaccine scare.
Representation by the good senator from Ohio. We worked to open the schools and open the state by just making sure people had a test so that they were negative. It helped us. And we didn't force people to get vaccinated if they wanted to travel. And I didn't support mandates, just so you know the truth.
That's fine.
Right. So a lot of this, of course, is tilted very heavily to demonize this vaccination and the process. And I respect if the data comes out and shows that, or someone covered up, I respect that.
So I will say the COVID cartel was tilted very strongly to demonize these people, okay? To vilify them, to, offer retribution. So no,
But you just called them a cartel. You don't think that's demonizing somebody?
So there's no doubt this panel is definitely tilted toward one side, but the vast majority of the media and the agencies and everything else are tilted toward the one side, and that's what's so frustrating. The reason we'll have a tough time the next pandemic is because our federal health officials and the media lied to us, and we have proof they lied to us, and we have proof that they went and they used the power of the federal government to have social media companies censor people. Dr. Walscott, I do want to cover this because this is egregious, and people committed suicide because of this. But talk about how Facebook, after our event in Milwaukee, talk about how Facebook repeatedly shut down the support groups for the vaccine injured. That was their only lifeline because they could not get help. They weren't believed. They only had each other. And so they had these Facebook groups, and Facebook shut them down, and people lost contact, and people committed suicide because of it.
Yeah, so this is now earlier in 2021 when there was just a couple of isolated people across the country early on. For example, Breanne Dressen, who's my co-chair at React 19, she was injured during the AstraZeneca trial, so very much in the fall of 2020. And early on after that episode, she started communicating with some other people across the country, and her husband has some connections out at the NIH. That group started communicating with Dr. Nath, who is a neurologist at the NIH, who clearly confirmed that these injuries were vaccine related. These people started giving each other support. Really, what do we do? What do we do? Communicated with Senator Johnson's office. And in the end, they had a press conference in June of 2021 in Milwaukee. And the idea of the press conference, again, don't let me speak for you, Senator, but was just to allow these people to be acknowledged and to communicate their story. Well, not only did the media show up and not cover their story, it turned into a hit piece basically on Senator Johnson. But more importantly, within 3 to 5 days after that press conference, all of those support groups that Breanne Dressen had set up were all shut down. And in retrospect, they found out that, through the White House Communication Office, who was communicating with another contractor who was following her, and they directly through the White House Communication Office shut all those groups down. And you might say, well, it's too bad they can't communicate with each other. No, some of the people were suicidal and subsequently killed themselves. So this resulted in.
And Governor, again, I've heard you say, and we should never do that, and it's regrettable and all kinds of stuff. But that's what happened. It happened repeatedly. It's still happening.
Look, let me support Dr. Walsog, okay, for a moment. Okay, first, I will be empathetic. It is terrible. And believe me, this is not anything that I would do. But let me just say this.
Tell you, Peter Marks didn't find it terrible because he's behind it.
Okay. Well, but I do want to say that is terrible, and we should have open communication. However, that is not necessarily what I'm feeling. The love here in the hearing, okay? And mind you, I spent 14 years on your side of the desk, and I spent now 6 years on the other side as an executive. The truth is, it's always somewhere in the middle. People have their biases, and if it's true that the Biden administration, encouraged people to not share information, that's bad. But there was another president also that was encouraging the vaccinations, and so we had two presidents, one Republican, one Democrat, in fairness, who they promoted the vaccine. And so all this conversation about not sharing enough of the potential risks and so on, everyone, and I would say this, everyone, including you guys and us.
And they both promoted it because of the information being provided to them by the people you're saying we should trust. That's the problem. Those presidents trusted the science, and it was a mistake for both of them to do it. So maybe we need to fix these institutions instead of just trusting them.
Good people, we're all responsible as a society to do our best to communicate. And when I hear words, just forgive me, when I hear words, you use the word cartel, and I'm not going to defend anyone. I'm saying that word is explosive, okay? And
It was developed out of firsthand experience dealing with them.
Dare I say the
And I-
explosive nature of the word is the point, because that's what the situation requires. A little bit of explosive hyperbole.
I have plenty of words to share about the people that threaten my life. Many, many times, because I was a public health official, not even in favor of the things they were threatening my life over. Many times. Had to send it to our attorney generals. I'll get you copies of that too, Senator, if you'd like, okay? Pretty awful stuff when they threaten my daughter's life. We have also an 18-year-old daughter, sir. And so that is the problem here. Now, I am appreciative of the process you're going through, because we should look at the horrible episode, which is what COVID was, and do better in the future. But if it ends up being skewed to the demise or the suppression ultimately of vaccinations, which is what a large part of society is fighting to do, then we will all lose.
So
And
again,
that's why I'm speaking up.
What we're trying to do is restore integrity to science, which it has been corrupted. Again, you pay for science, you get the result you want. You got Fauci paying for science for 40 years, he's getting the result he wants. So again, I'm begging you, please provide the studies, the citations that prove that the injection actually reduced severity of symptoms, prevented deaths. Give us those studies so we can throw those in the hearing record and compare them to other studies like, for example, the Lassiter study or Lataster study that I did enter.
It will not be difficult, Senator. There's so many.
And again, listen, as I said, I'm well aware of the fact 5. I think I've given you a fair amount of time to respond and stuff, and I've tried to be
I'm
respectful.
used to talking a lot. It's okay.
We all are. It's an occupational hazard here, and we'll just prove it here, Senator Blumenthal.
Thank you. And I'll have to be quick because I have to actually go to the floor. I've just been at my other committee meeting. And I want to ask you a kind of yes or no question, Governor Green. HHS apparently is making plans to change the way that vaccines are approved, requiring placebo trials for vaccines that have been used previously for decades. In other words, the clinical trials on vaccines already in use will involve placebo trials. I understand a lot of doctors feel that this practice would be unethical.
Why would it be unethical? Why is testing something again a bad thing? That's point number one. Point number two, the reason that they're requiring that is because these guys have been monkeying around with the definition of placebo. I believe it was Alex Jones who said that they were actually taking old vaccines and treating them as placebos. So they've been monkeying around with the trials, and that's why they're having to do them again. But again, even if that weren't true, why would testing them again be a bad thing? Unless they got something to hide.
Do you agree?
Yes, that will be unethical.
Thank you.
Why? Why would that be unethical? Why? That doesn't make any sense. You're just throwing a random word out there.
And it will be unethical because we already have demonstration that people get protection. So it's unethical to give them a placebo and watch kids die of meningitis or
That
diphtheria.
doesn't mean they can't get the right vaccine afterwards. It's not like a clinical trial lasts forever. What? Kudos for trying to answer the question, I guess. That's just ridiculous.
Or polio. That's why it's unethical.
It's not unethical to study. It's not unethical to research. It's not unethical.
So now we have to say, wait, are we saying that placebo trials are just bad altogether? I'm confused. I don't think placebo trials are just given to people who are already sick. Like the whole point of a vaccine is to prevent the sickness. Why would you be giving somebody a placebo for polio if they already have polio? That's ridiculous.
Run trials, but
Am I not hearing that right? Somebody correct me if I'm not hearing that right, because that, to me, that sounded really stupid. So I'm doubting myself because I'm like, surely they couldn't have been that stupid. I must have misheard something.
possibly put people at risk when a particular vaccine has already been proven safe and effective and has been in use for decades, that would be unethical.
Correct, Senator.
Thank you.
That's just ridiculous.
I want to ask Dr. McCullough, I understand that you are an executive of the wellness company, and that the wellness company has made money from the sale of supplements and other, quote, spike detox products. Is that correct?
I'm the Chief Scientific Officer of the Wellness Company, which is a national company started in 2022.
I feel frustrated that I even have to bring this up, but inferring motive is not an argument. I agree. TTN Day J or DJ MC says it definitely sounds stupid. Yeah, it's ridiculous. I feel stupid bringing this up. Inferring motive is not an argument. And he was saying that these vaccines were bad before he ever even started the company. So this is dumb on multiple levels.
Healthcare. So it's a company of doctors. Also provides nutraceuticals and supplements, fully prescribes drugs across the range, health education materials.
How much money has your company made from the sale of spike detox products?
And the company has innovative products like spike detoxification based on peer-reviewed studies demonstrating the scientific underpinnings for a combined use of three over-the-counter nutraceuticals, which are nattokinase, bromelain, and curcumin. You can buy them anywhere on the internet if you want them. So the company, I don't have the company's balance sheet with me, but I can tell you its overall valuation right now is about $50 million with an M. And that pales in comparison to the tens of billions of dollars that the government spent on vaccines that have caused great harm. At the Wellness Company, we are trying to help the country recover, whereas further vaccination is putting the country into a big hole in terms of damaging their health care.
And
Yeah, that deserves a contemptuous applause.
your company, that company also makes ivermectin? Ivermectin?
The company can prescribe, the doctors can prescribe ivermectin, they can prescribe Paxlovid, molnupiravir, they can prescribe any drug within the pharmacopoeia.
How much have been the profits from the sale of that drug since 2020?
Well, it's prescribed, so whatever pharmacy delivers it, like CVS or Walgreens, they would derive any
I'm
profit.
talking about profits for the company.
It can't, because they prescribe drugs to pharmacies. The pharmacies are the ones that people pay to get the
What
medication.
is do you have a personal share in profits from the wellness company?
Yeah, I receive a set salary. I don't receive any % share of profits, and I have a very minor equity stake in the company. I work there part-time. I'm full-time in practice. I'm also the president of the McCullough Foundation.
But you do share in the revenue and profits.
I receive a set salary.
Let me ask you,
So that's
again,
it's an incorrect assertion. I get a set salary. I do not have any sharing of any revenue that comes in,
Okay, thank you.
okay?
Has your board certification ever been revoked?
I resigned from the American Board of Internal Medicine November 11th of 2024 due to an ongoing dispute over the term you've used, misinformation, which is
So
a propaganda term. It's
your
a
board's-
leverage term. So I had a dispute. I resigned from them. Listen, I'm one of the most published people in the American Board of Internal Medicine. They rely on my research for a lot of their board materials.
So
and then-
you're no longer board certified?
I'm board certified by the National Association of Physicians and Surgeons. There's many different organizations that provide board certification.
Which one did you resign from?
The American Board of Internal Medicine, after 40 years of a perfect clinical track record.
Thank you, Mr. Chairman.
So not only was it a stupid ad hominem that was going after his credibility, his facts were wrong. He's still certified. Good job, Blumenthal. Excellent way to do research.
A perfect example of the vilification of people that had a second opinion. By the way, it's always my understanding in medicine that if you had a serious health condition, you go seek a second opinion, because nobody has all the answers. Every human body is different, but you know, that was an unfortunate line of questioning.
Yeah.
Mr. Siri, do you want to describe why it's appropriate for HHS Secretary Kennedy to actually do some research on vaccines? I'm quite sure, tell me if I'm wrong here, but when Mr. Kennedy pressed Fauci for the random control blind placebo trials on childhood vaccines, thought, oh yeah, we've done all kinds of them. Couldn't produce one. I know in testimony we've had other officials of the CDC or FDA ask the same question. They just can't come up with them. So can you set the record straight in terms of what studies have actually been done on the vaccines on the childhood schedule?
Absolutely. So in my 66-page submission, I set out every single routine childhood vaccine on the CDC schedule today with sources citing to the FDA underlying clinical trial documents that confirm. So if you dispute this term, you got to argue with the FDA. Not a single routine childhood vaccine on the current schedule, other than the Covaxin licensed for 12 and older, was licensed based on a clinical trial in which the control group received the placebo. And if the control group received another vaccine, that vaccine was also not licensed based on a placebo-controlled trial. That is all set forth in here. It is categorically accurate, a placebo meaning an inert substance.
By the way, do you want to just talk about some of the most egregious examples? One I found, and this is off of a blog, or I mean off of a podcast, so, but I'm assuming it's true because it hasn't been disputed. Apparently, the approval for the aluminum adjuvant in vaccines was done off of a trial with 4 rabbits.
Aluminum adjuvant
one of the rabbits died. They killed the other ones after 28 days and found all kinds of aluminum in the body, but they approved it anyway. So good go. Is that true as well?
Aluminum adjuvants are not, they're used to induce autoimmunity in lab animals. They are part of the active ingredients. They're not separately approved as their own standalone product. Injecting a child with just aluminum adjuvant would be entirely unethical because it has no therapeutic value in and of itself, unless you want to treat them like a lab animal.
I'm not suggesting do that. I'm just saying, but that's what it was approved for use in vaccines.
As far as I'm aware, actually, it's never been approved, aluminum adjuvant standing alone.
Oh, okay.
And I'm not aware of any such approval. But to answer your question, why look at the safety of childhood vaccines? And the answer, I think, is this. We should be looking at all environmental insults, because we are in the midst right now of a pandemic. There's been a lot of talk. We got to be ready for the next pandemic. We have a pandemic right now. It's a pandemic of chronic disease amongst our children. Over 50% of kids in America have a chronic disease right now. That's up from under 13% in the early 80s. What's changed? What has caused massive immune dysregulation to occur amongst our children? Why do I say that? Because most of the chronic diseases that we've seen exploding, asthma, you go down the list, have an etiology in being a form of immune dysregulation. And I've set that forth in my submission as well. So you have an explosion in chronic disease since the early 80s. Most of those chronic diseases are a form of immune dysregulation. What has changed in terms of might be causing the immune systems of our children en masse to go haywire? Well, maybe we should start by ruling out the fact that we have gone from 3 injections on the CDC schedule in 1986, the year the National Child Vaccine Draft was passed, to currently, if a child gets the full CDC schedule, follows it today, by 1 year of age, gets 29 injections, including in utero, okay? 3 to 29. And every one of those vaccines, as I mentioned earlier, was clinical trialed and licensed by a company knowing they would not be liable for design defect claims. We need to study that,
so
like
maybe you ought to
everything else.
study that. Okay, I think we've probably gone about as far as we're going to go today. What I am going to do is give each one of you, and we'll end with the governor. You can have the last word. Well, I have the last word. But give you each, and I really respect it, not much more than a minute. If there's just something non-itchy point you want to make, can you make it in a minute? And we'll start with you, Dr. McCullough.
You've asked for us to cite evidence. 3 papers by Nathaniel Mead, who's in the audience today, a former National Institutes of Health writer, 3 of them that contain nearly 1,000 references, so they're all there in these papers, have concluded that the risks of COVID-19 vaccination far outweigh any theoretical benefits. We've heard countless wishful thoughts from Senator Blumenthal and from Governor Green, Dr. Green, but they're wishful. They wish the vaccines would have saved lives. They wish the vaccines would have reduced severity. I can tell you, because you know this, I was one of the few doctors who was on the real front lines of treating acutely sick patients at home. That's how we reduced risk of death, not via a vaccine. The marathon runner, he passed away because he didn't receive effective early multi-drug treatment. It didn't matter whether he took a vaccine or not. Our CDC knew about thousands of patients fully vaccinated early in 2021 dying of acute COVID-19. It was abundantly obvious the COVID-19 vaccines did not reduce the risk of death. I don't want America to be fooled by this hearing today, thinking that the vaccines save lives, because they didn't.
Dr. Vaughn, please, audience, please. Dr. Vaughn.
So I challenge physicians to really return to the 2 C's of medicine, which is care about the person, the actual human being in front of you, and actually be curious about why they're there and why they seek help, not tell them that it's all in their head and there's nothing you can do. And nothing I have read has said that your problems are problems that I can do anything about. Instead, especially when we look at vaccine injury and long COVID, we're talking about 10 to 15 million people that are suffering, and we have a medical community that doesn't know how to help them. We have to study it, and we have to get back to caring about our patients and being curious about what their ailments are.
By the way, real quick question, because I meant to ask this. You hear long COVID, you hear vaccine injury. You know, kind of my assumption is most doctors look at a vaccine injury, call it long COVID. You know, what do you think the breakdown is? Because long COVID exists, right? I mean, that spike protein's a nasty thing.
And so just again, I think one of the biggest things is, at least in the 4,000 patients I've seen, about 80% of them have been vaccinated, 20% have not. And so long COVID does not equally mean that you have had to be vaccinated. There's plenty of people that didn't get vaccinated that have long COVID. But the problem currently in the way the studies are done is they are not disambiguating that data. And it needs to be collected, and we need to study it.
Okay, Dr. Thorpe.
Thank you. I'm an extremely busy clinician, 45 years, okay? When I just in the past, in my tenure, 4.5 years, while I was working through the pandemic with SSM Health, 4.5 years, I saw 27,500 high-risk pregnant patients. It was extraordinarily busy. I published extensively during that time on the government database, on Pfizer's data. I gave it to my chain of command. Never once did they treat it as science. Never once did they allow me to present in grand rounds. And after I presented under your last testimony in 2022, I was fired from SSM Health because I brought it to their attention. It was never discussed at a department meeting or at a division meeting or at a grand rounds. That's not science.
That's corruption. Dr. Wolskog.
Thank you. I'd just like to review a little bit about some of my frustration with regards to continually hearing how vaccine injury is rare. So just for a second, let's all look at big numbers. There's over 17 billion doses of COVID vaccines given worldwide. The Freeman study shows, and again, this is just for serious adverse events, ones of special interest, 1 in 800. That's 1/8 of 1%. Multiply those two numbers, and you have about 22 million adverse events to COVID shots worldwide. Multiply that by 4.34%, which is about our U.S. population as compared to the rest of the world. That's over 900,000 serious adverse events to COVID shots here in the United States. And I think it's time to recognize these people, to research them, to provide them care, which they are not getting, and to consider getting them, and really getting them fair and just compensation. Thank you.
I think it's well past time. Mr. Siri.
I'm just going to quickly correct the record on a few things I've heard here today, if that's okay. First is that most vaccines, including most childhood vaccines required for school, do not prevent transmission. They're just personal protection, like pertussis vaccine, activated polio vaccine. And I've heard a lot about COVID vaccine. COVID vaccine does not prevent transmission, which makes a lot of what was discussed here today, when you put it in that light, doesn't make much sense. And if it does reduce symptoms, it actually makes you more likely to transmit, because if you don't have as much symptoms and you're still transmitting, you're less likely to stay away from other people. I've also heard people talk about what the FDA's new guidance is. They're no longer going to give COVID vaccines to those who are in low-risk groups. That's not what the FDA said. Read it. What they said was that they're going to require proper clinical trials for those in low-risk groups, as they should. And I don't understand why there was so much talk about being opposed to this new FDA guidance. Why do we oppose gold standard science? Also, in all this discussion about the deaths from COVID-19 vaccine, since we're going to rely on clinical trials, let's look at what happened in the clinical trial for the Pfizer COVID-19 vaccine. 21 people died who got the vaccine. 17 died in the placebo group. That's what happened in the clinical trial. And if we're going to then look at all-cause mortality, those match up pretty good, okay? The FDA, when it came to getting 95% effective, remember that at 8 people in the placebo group had symptoms, 162 in the vaccine group had symptoms, putting aside there were another 3,000 that weren't tested that had symptoms. They used that statistical comparison to get their 95% figure. They should have done the same thing for deaths, but they didn't, because it doesn't fit.
Hey, look, an ad. Right here at the end. That's just great.
Their approach to get this product on the market, and so they let Pfizer explain away all the deaths, even though there were probably almost twice as many deaths for COVID, of cardiac related. Also, you got to ask yourself, it's been 4 years that they're telling us the COVID vaccine is safe. So if it's safe, why do they still need immunity? Why does the manufacturer of this product still need immunity? All you'd have to do is 2 things to not get sued, just like you do with drugs. 1, make it as safe as technologically possible, and 2, disclose the risks. Then you can't sue for design defect claims, and you can't sue for failure to warn. Why don't they just lift the immunity, let them make it as safe as they can, and disclose the risk? Even drugs given to small populations can exist and make a profit, because they do those 2 things. And why, after 40 years of childhood vaccines, can they not lift the immunity for a lot of them? Why? You got to ask yourself that question, because they don't either want to make them safer, because for whatever reason, or they don't want to disclose the real risks.
Okay, Mr. Siri, I gotta. Okay.
I have 3 quick more.
No, I've got to move.
I got it. Okay.
Governor Green.
Okay, thank you for having me, Senator. A couple of things. I feel strongly about this. I feel strongly that vaccines save lives. I also acknowledge people who have different beliefs. I will say that a lot was said about being civil and kind to people who have disputed positions. Just so you know, one of the gentlemen who is on the panel today had their organization send out a hit piece on me back in my own home state. It was a very unusual thing as I came to testify in good faith, talking about my response, but also talking about the things that have nothing to do with COVID, talking about how I am as a governor. So there is an ugliness out there that we all are going to have to navigate, and I want to acknowledge that. I will tell you that I oversaw a public health mission which resulted
Forget
in
all the people who potentially died from this thing. People were mean to me.
90% vaccination rate, which is quite extraordinary for this circumstance. And for our state, which was a closed system, we did very well. We had, and I will bring you, probably to your dismay, a truckload of data and paper and information, and it will be compelling. So hopefully that will be considered by those who have different opinions. And I will consider their different opinions. But I will tell you this, I will caution everyone that as we go down the rabbit hole of possibly moving away from vaccinations or vaccination programs, be very careful what you wish for, because as a physician who is still practicing, as a person who has spent many, many years practicing for the public health service, mind you, we will be in dire straits if we walk away from vaccinations and science. And the last thing I will tell you is I sat in, I believe it was this room, it was a similar room for sure, listening to the Secretary of Health and Human Services prior to his swearing in talk about how he wouldn't even walk away from his professional life and his profits based on the work he's doing. And I'm not trying to demonize him because, as I've shared with you, I believe in some of the things that he supports. But when I hear from colleagues, people who are testifying about immunity, they have interests, and those interests should be walked away from. If anyone's going to try to influence you, walk away from your interests, walk away from your vested positions. Be truth tellers, perhaps. Be part of the public health solution, but do not suggest that you are not compromised as you suggest others are compromised. We should fight for equality, and we should fight for that kind of standard on both sides. That I recognize from the fellow testifiers, but there has been quite a lot of hypocrisy. And because I'm one of 6 and had to face some somewhat, let's just say, caustic moments, I don't want to complain. I just want to say the future of healthcare is going to be for us to come together, not demonize one another. And we can talk further about that privately. Thank you, sir.
Well, I regret caustic moments. I regret any kind of attacks.
So, these men are bad men, and if we do this thing that nobody suggests, i.e. get rid of all vaccines, the sky will fall, the moon will turn to blood, and it'll be the end of the world.
Support that at all. But I also don't like being accused of walking away from science. I mean, we're trying to restore integrity of science. I think it's indisputable it's been corrupted in many cases. So I want everybody at the table, okay? And we'll take a look at our next hearing in terms of how we maybe create a little more balance here. But regardless, I do want to close and conclude that I know, as I said earlier, there's a lot of anticipation for this hearing. You know, I appreciate that. But I also want to caution everybody, this is going to be a slog. This isn't going to be some one hearing or one piece of information or one study that, okay, this side proved they're right or the other side. You know, science isn't like that. To me, the best definition of science is skepticism. Now, skepticism hasn't been allowed. I mean, that'd be my point, Governor. We haven't been able to ask these questions. Those who do are vilified. Their careers are destroyed. Their licenses are pulled. Their accreditation is gone. Because you do have a cartel. It exists, okay? I think it's undeniable. So, again, we're the little people in this debate and argument. You know, the side, you know, the other side has all the dollars. They've got the media. They've got the bullhorn, all that kind of stuff. These are the little people here. They're being crushed by it. They've been crushed by it. But they've stood tall, and I appreciate that fact. But that being said, I'm not buying, you know, I don't just blindly say, okay, you said that, so that's what it is. I'm asking all of them, all of you, provide the science, be willing to debate. I'm hoping on my next hearing, because we did this in my events, we always invited the federal health officials. Okay, now probably need to get the federal health officials from the Biden administration. They're the ones kind of responsible for a lot of that. Come forward. I'll give them an open forum. I'll give them, you know, equal access.
They won't. They won't, because the reason this hearing is so one-sided is because nobody from the other side will even show up. Because they know. They know.
The executives from Pfizer and Moderna, come on forward. Defend yourself. Okay? Engage in the scientific debate. They haven't been willing to do that in the past. They hid things. You've had to, you know, not only FOIA, but then sue under FOIA to get the information. That's, again, so there's a history here. There's a reality of what's happened. If there's frustration, a little hard feelings, you think you see it bubbling out. But again, put yourself in the shoes of the vaccine injured, who have seen their groups shut down by Facebook, who have got the emails from the families or the final suicide note for one of those people. There are people in this room that have gotten that suicide note. And they're still not acknowledged. They're still being gaslit. They're still being vilified. So that's the reality of the situation. I ran for a third term because nobody was advocating for the vaccine injured. And I apologize for not having, no. I apologize up front for not having a hearing earlier, but it takes time to get this information. And again, we only had a little bit, which allowed, Senator Blumenthal to pick apart the evidence. And I didn't say we made the full case. I've got indication we can make a pretty full case over the next at least 2 years during this chairmanship. So that's what I'm dedicated to doing. Stay tuned. There's going to be more to come. God bless all of you. By the way.
All right. So that is the congressional hearing on the jibby jab. So credit to Senator Johnson for having it, but I doubt anything will come of this because who watches the watchers, as it were? You want to restore credibility to science or whatever, you got to create accountability, which these people don't want. So, special thanks to the Union Herald for actually putting this out and making it possible. With good audio, by the way, when we did the alien congressional hearing, it couldn't hardly listen to the audio because there was such a bad echo. So, credit to the Union Herald. Appreciate them putting that out. And, they have a YouTube channel that I would encourage you to visit. And we're going to wrap it up here. I don't know how many times I can say that guy was just basically screaming everybody was mean to me and we need to, keep the institution as it is because basically what might be will be infinitely worse. That was the gist of his argument. The unknown is always worse than the status quo, so keep the status quo. That was the long and short of it. So, yeah. The most interesting point that I found fascinating was Francis Collins' response, which surprised even me because I figured he was more of a dupe. It seems like he was apathetic to the whole thing. So that was actually a surprising revelation. But with all that said, I think we're going to call it a night. Thank you if you stuck through the whole thing. Really appreciate it. And hopefully you found this little reaction to the congressional hearing useful. So with all that said, guys, thank you so much for watching, and we'll see you next time. We hope you enjoyed this episode of Faith, Fiction, and Folklore. If you did, we would love it if you would subscribe to us on YouTube or follow us on Rumble. We can also be found on X, Instagram, and Facebook. And we are available on Spotify, Apple Podcasts, Amazon Music, and iHeartRadio. Thank you again very much for listening, and we'll see you next time.